the teacher channel. Welcome to this very presentation, standard first aid and CPR questions and answers, and this is part 1, the first part of this series. Please subscribe if you have not done so. So if you have not subscribed to the teacher channel, this is the opportunity please to do so, and you can also give us thumbs up. Yes, thumbs up if you like what we're doing. Why not encourage this channel by giving a thumbs up? You can also put your comment on the comment box below. Tell us how you feel. Tell us how the content is. And if there is any suggestion you have for us, please do not hesitate to put it on the comment box. You can also turn on your notification bell so that when new videos are uploaded, you will get notified. Thank you for doing all this. Objectives. There are 2 objectives to prepare you for the first aid and CPR training. So if you are planning for the first aid and CPR training, this will help you a lot. Number 2 objective is to refresh your memory, your knowledge of the basic first aid and CPR concepts. So this is refreshing. Okay, you are going to find the content, the questions and the answers very, very helpful. Now, question number 1, what is first aid? And the answer, first aid is a basic or emergency care given to a person who is ill or injured. So this is the standard definition of first aid. It is a basic or emergency care given to a person who is ill or injured. What are the objectives of first aid? There are 3 of them. The 3 objectives of first aid are: number 1, to preserve life; number 2, to prevent injury or to prevent more injury; and number 3, to promote recovery. So those are the 3 objectives of first aid. What terms can be used to describe a person who receives first aid? A person who receives first aid can be described as patient, victim, or casualty. So 3 of them can be used interchangeably. So whether you use patient or you use victim or you use casualty, they are all pointing to the same person, which is the person who is receiving first aid. How many categories of patients are there? So there are 3 categories of patients. Number 1 category, infants, infant category, and this category consists of persons or people who are under 1 year. So an infant is a person who is younger than 1 year old. Another category is the child category, and a child is older than 1 year but has not reached puberty. Then the 3rd category is adult. An adult is a person who is going through puberty or who has gone through puberty already. So 3 categories of patient, infant, child, adult. What is the person who gives first aid called? What is the person who gives first aid called? So the person who is providing first aid, what do you call that person? The person who provides first aid is called a first aider or a first aid provider. 5b. What are the roles of the first aiders? What are the roles of the first aiders? First aiders play important roles which include: number 1, preserving a patient's life. Number 2, preventing injury or preventing more injuries from happening. Number 3, promoting a patient's recovery. So those are the 3 roles that first aider plays. 6. What is the Good Samaritan laws? What is the Good Samaritan laws? This is a legislation which applies to a bystander who tries to give first aid to an ill or injured person. This is a law or legislation which applies to a bystander who tries to give first aid to an ill or injured person. In Alberta, this law is called Emergency Medical Aid Act. Emergency Medical Aid Act. What is the main objective of Good Samaritan laws? What is the main objective of Good Samaritan laws? To protect the first aiders from some forms of liabilities. So the main objective of Good Samaritan laws is to protect the first aiders from some forms of liabilities. So this law protects the first aiders from liabilities. What are the obligations of the first aiders to be protected by the Good Samaritan laws? So for the first aider to be protected by the Good Samaritan laws, what are the obligations of the first aider? To be protected by the Good Samaritan laws, the first aiders must: 1. Use reasonable skills. 2. Stay within the first aid scope, so don't go outside the scope of first aid. Number 3. Obtain consent from the injured or a person. Number 4. The first aider must not abandon the person being helped. So abandonment is not allowed. Number 5, protect the patient's privacy or confidentiality. So once these 5 obligations are adhered to, the first aider is protected by the Good Samaritan laws. How many types of consents do we have? How many types of consents do we have? There are 2 types of consent or permission, namely voluntary consent. And what is that? Permission given by a conscious patient who is legally and mentally able or capable. Permission given under no threat. So this permission is obtained under no threat. So there's no threat here. It has to be voluntary. Implied consent. So this is the second type of consent, is called implied consent. The law permits the first aider to give first aid to an unconscious patient or someone who has not reached the age to make decisions independently. Example is a baby who is left unattended. So you use implied consent in that situation. What is the main purpose of personal protection and safety? What is the main purpose of personal protection and safety? The main purpose of taking personal safety and protective measures is to protect oneself as well as the patient. So that's the reason why you take safety and protective measures to protect yourself, the first aider, of course also to protect the patient. What are the routes through which disease can be transmitted? So what are the channels of disease transmission? The 4 routes through which diseases can be transmitted are, the 4 routes through which diseases can be transmitted are, number 1, direct contact, number 2, indirect contact, number 3, airborne, and number 4, vector-borne. Vector-borne applies in a situation where somebody becomes sick as a result of maybe insect bite or animal bite. Example is mosquito and malaria that come from mosquito bite. What is a hazard? A hazard is anything that can cause harm or death. A hazard is anything that can cause harm or death. Example, wet floor. Another example is toxic fumes and harmful chemicals. Another example is high voltage electrical wires, and also moving vehicles can also be hazards. Question 12. What is an emergency scene management? What is an emergency scene management? An emergency scene management is a sequence of activities or actions taken to lessen the impact of emergency on a patient. An emergency scene management is a sequence of activities or actions taken to lessen the impact of emergency on a patient. How many sequences are in emergency scene management? How many sequences are in emergency scene management? Emergency scene management is comprised of 4 sequences. So there are 4 sequences in emergency scene management. They are, number 1, scene survey. Number 2, primary survey. Number 3, secondary survey. And number 4, ongoing patient care. This is important. Okay, so emergency scene management comprises of 4 sequences: scene survey, primary survey, secondary survey, ongoing patient care. What is scene survey? Scene survey is the first step, first sequence in emergency scene management. So, scene survey is the first step in the emergency scene management sequence, in which the first aider rapidly scans or checks for potential hazards in the immediate area where emergency has occurred. So scanning the area, checking the area for potential hazards in the immediate area where emergency has occurred. That is what the scene survey is. What is the purpose of doing scene survey? This is the first sequence in emergency scene management. What is the purpose? The main purpose for doing scene survey is to ensure the safety and protection of the first aiders as well as that of the potential responders, people that may join later on. So scanning the environment is actually what is intended here, so that one will ensure that one's safety and protection is guaranteed. What activities are included in the scene survey? What activities are included in the scene survey? The scene survey activities include number one, or the first one, scanning the area for potential safety, for personal, So scanning the area for personal safety. Scanning the area for personal safety. Next one, taking protective measures, e.g. donning gloves. So when you put on your gloves, that is part of the activities here. Identifying if help is available. So yearning for help, yelling for help, asking if any help is around is also part of the activities. Introducing yourself and asking for permission or consent is also expected at this stage. Introducing yourself to the patient and asking for permission is expected at this stage. Thank you for watching, and please, if you have not subscribed, this is an opportunity for you to subscribe. Please subscribe to the channel. That is the support you are giving us. Please type your comments on the comment box. So if you have any suggestion, if you like to say one or two things about the content, to give suggestion, please put it on the comment box below. And you can also contact us through email at theteacherchannel@gmail.com. So that is an email that you can reach us at. So thank you so much, and part 2 is on the way. Please watch out for that.